Did you know that behavioral difficulties such as defiance and aggression and tantrums can actually be a sign of childhood depression? Well, stay tuned for more information on this subject from a child psychologist. Hi, this is Dr. Brett Pearce, child psychologist, coming at you with an educational video on the subject of childhood depression. The intention of this video is to go over some common signs and issues associated with childhood depression, but first and foremost, it is to say that childhood depression, that is, certainly exists, and it needs to be addressed. And it may sound a little bit strange for me to say it certainly exists, but it's an often overlooked issue, and many people hold a lot of interesting beliefs out there, including well-intentioned allied professionals who might be supporting kids. They often people believe that kids just can't get depressed, or they only get depressed under certain special conditions, like having experienced a trauma or something like that. And effectively, all these things are myths. So, first of all, let's talk about what childhood depression is. Well, first of all, childhood depression is depression. It's a mood problem, just like it would be in teenagers or adults. But what can be understandably mysterious about childhood depression is that the signs and symptoms of childhood depression, particularly at first, without really finding them out, as it were, can seem fairly mysterious. So for us folks who work with kids, the common things that bring kids in to see us for therapy are things like defiance, aggression, behavior problems, and the like. And all of these are very understandable and legitimate reasons to bring a kid in to get some help. However, the troubling thing is that defiance, aggression, and tantrums don't end up being necessarily that helpful from a diagnostic perspective, which is to say, one of a number of things could be going on when we hear that kind of constellation of what we call presenting concerns from, usually from parents who are bringing kiddos in to see us. Kids who are depressed very commonly deal with irritability, low mood functioning, feeling negative about themselves, about others, about life, maybe quick anger problems, and certainly when you get down to it, there is an inner sense of, I just don't feel good, I don't feel right, I'm having a hard time feeling happy, and things like that. But one of the challenging things is that kids are not necessarily good at investigating and understanding their own inner experiences, which is completely understandable. There's plenty of adults who struggle with that. So what can happen is you can have a kiddo who, let's say Sarah, who's 8 years old, who starts to act out a lot, who starts to refuse to go to school, who starts to maybe struggle with grades and things like that, where she normally was doing fine, maybe starts to kind of fight with her parents a lot. And what happens is it's easy for us to want to say, oh, these are all just behavior difficulties. And in a certain sense, they are behavioral difficulties, but that's also true of pretty much anyone who's struggling with depression. For example, if you have someone who's depressed and just stops doing chores, stops taking care of themselves from maybe a hygiene perspective, and doesn't have the energy or motivation to pay their bills, those are all sort of behavioral issues in a sense. Like they're important behaviors to do in order to maintain important things in life. But no one's just going to say that's a behavior difficulty with a depressed adult. Probably because the depressed adult can also say, I feel sad all the time, I've got no energy, I don't feel like doing anything, I'm, da-da-da-da-da-da-da. That adult can list usually fairly clear and obvious symptoms of depression, whereas Sarah is likely to struggle to articulate those symptoms directly, just because Sarah doesn't have the same kind of cognitive development as an adult has. Sarah doesn't have the same bank of experience to kind of sort through and compare what she's going through, because in an outward sense, depression could look like feeling sick, depression could look like being underslept, etc., but most people can see and notice the difference fairly well, particularly with a little maybe help and support and guidance from someone who's familiar with sorting through that themselves. So what happens is we often get into self-fulfilling prophecies with these situations, where we start to call a kid like Sarah ODD, or maybe we start to want to make the argument that it's ADHD because Sarah's concentration is down. By the way, poor concentration is a diagnostic criteria for depression, at least one major depressive disorder. So poor concentration is something we have to be careful about with kids jumping to the conclusion that it must be a function of ADHD. But that's a topic for a whole other video. So bottom line is, what very commonly happens is that kids with depression, the most noticeable things to us adults are going to be those significant behavioral difficulties like tantrums and defiance and maybe, refusing to go to school and things like that. Commonly, though, there are other relatively obvious, at least in my view, symptoms of depression that are going on that tend to be kind of missed or minimized or dismissed. Things like talking poorly about oneself. For example, Sarah saying, "I'm stupid, no one likes me, I can't do anything right." Or maybe even talking about wanting to die. And by the way, childhood suicide is a thing and it needs to not be ignored. And at least in the greater Salt Lake area, we've had a few tragic situations over the last year of fairly young folks who have taken their own lives, like not even quite teenagers. It's deeply, deeply tragic. And my belief is, and I believe the evidence supports this well, is that, addressing depression, helps to prevent that. But coming back to the topic of depression, you will see often signs of depression in kids that do seem a little bit more kind of classic when it comes to depression. A lot of negative self-talk, maybe a lot of tearfulness, and again, very commonly, people in our culture tend to dismiss kids crying as being usually a kind of behavioral difficulty, unless the kid is crying for a reason that we would sort of agree is okay, which I always struggle with that. But there's not many people who would say that if a kid fell down and hurt themselves and was kind of crying, that's a problem. But often when the kiddo is crying because they're just overwhelmed or stressed or depressed or anxious or something like that, I've seen a tendency to want to view that as a kind of misbehavior, or there's a tendency to kind of view it as a sort of manipulation. So what ends up happening is that we often find that we are creating a sort of self-fulfilling prophecy with kids who are depressed, where we view them as kind of misbehaving, where we're missing the fact that they're struggling with a mood problem. And that just kind of locks us into the cycle where we often are not connecting with them and supporting them in the ways that they really need in order to start to heal and to cope and to tackle these issues, and thereby kind of locking the issue into place, which tends to create and maintain misbehaviors, which we then tend to say, see, kiddos just misbehaving. It's yet another reason why I'm so against the use of punishment in general, is because this is certainly one of those situations where an emphasis on punishment is almost guaranteed going to worsen or certainly at least maintain symptoms of depression. But it's not my intention to launch into another rant on that subject, because I do that a lot on this channel. So what's tricky about trying to advise you in this video about what signs to look for about depression specifically, well, certainly if you see classic symptoms like kiddos who seem sad all the time, their energy starts to drop, they don't seem as interested in things that they normally would enjoy doing, they start to struggle with maybe sleeping too much or too little, or they have big appetite changes that don't seem right. Those are relatively classic symptoms of depression, sure, but I can probably count on one hand in the multiple thousands of cases that I've worked in as a psychologist with kids where someone came in, particularly with maybe a kiddo who's 0 through 10, and offered me that kind of a clear list of presenting concerns, which is understandable because kiddos are not really telling us that. They're not really showing us that. Often they don't really realize it themselves. And instead, what I would say is you really want to be thinking about marked behavioral difficulties, lots of big tantrums, lots of anger issues, lots of clearly just seeming like something doesn't feel right for the kiddo, like they're just not happy, and it's hard to get them to be happy, even if the expression of that is more like anger or irritability or combativeness or something like that. I think that those are reasonable signs to get your kid in to see a therapist anyway. But what I generally advise people to do in circumstances like that, particularly when I'm working with other professionals, is to dig deeper and to really try to rule out a mood issue. So I just think that you should take those behavioral difficulties and really try to view them as potential signs of depression. Additionally, other things like negative self-talk, talking, any kind of suicidal anything, those things need to not be dismissed. And they really do often indicate a suggestion of a mood problem, particularly when it's coupled with other signs that kiddos just not doing well. So this video has been just a little bit about depression. I did mention that there's a couple of common beliefs about depression that are a little bit puzzling that I think serve to kind of maintain this thing that we have where we tend to kind of miss depression. Just understand that depression develops for a lot of complex reasons in kids and adults. And the one big thing I would say is that depression doesn't need a clear cause to be depression. In fact, very puzzlingly, it usually doesn't have a clear thing that we can kind of pin it on. For example, a lot of people will say, well, kids can't have anxiety or depression unless they have a trauma. Well, we're getting into tricky territory here. So if a kiddo experienced a big trauma and had some anxiety problems for a little while, depending on how big, how much, how long, how much of a problem, we might be inclined to say, well, that's actually a fairly normalish reaction to an intense stressor, right? Like, whereas what's classically known with things like anxiety and depression is that these things seem to be overreactions to things or seem to be mysteriously sort of spontaneous in a sense. I'm not saying that folks who experience lots of stress in life aren't perhaps more vulnerable to these things, kids included, but it's just important to recognize that depression in kids does not need some sort of clear thing we could pin it on, like a trauma or a major stress or loss in life. Certainly that can be a significant exacerbating or contributing variable for sure. So at any rate, thanks for listening. This has just been a little bit about childhood depression. I hope that this video is of use to someone out there. If you found this video to be helpful, please do consider giving me a thumbs up and also subscribing with a button that you can hit down below. Otherwise, this is Dr. Pearce signing off. I'll see you in the next one. Bye-bye.